Assalamu alaikum. I am your facilitator with the new topic of protein synthesis inhibitors, and today I am only discussing the tetracycline with you. So let's begin the lecture. Concept of the protein synthesis inhibitors, mammalian ribosomes and the bacterial ribosome. What is the difference between the mammalian ribosomes and bacterial ribosomes? Why the protein synthesis inhibitors only specifically inhibit the growth of the bacterial ribosome, or it is the toxic to the bacterial ribosome but not to the mammalian ribosome. If it is toxic for the bacterial ribosome, then why not for the mammalian ribosome? Because the mammalian ribosome having the 40S and 60S subunits, while in the case of the bacterial ribosome, it contains the 30S and the 50S subunits. And specifically, if we talk about the tetracycline, it inhibits the growth of the it inhibit the bacterial ribosome of 30S. High concentration of the drugs such as chloramphenicol and tetracycline may cause effect as a result of an interaction with the mitochondrial mammalian ribosome. It is the structure of the tetracycline. Here you can see the A, B, C, D are the fused 4 ring. That's why it is called the tetra. Tetra means 4. Tetracycline because it is a cyclic structure. Tetracyclines are a class of the antibiotic which are chemical substances produced by the microorganism that are able to kill the other microorganism without being toxic to the person, animal or plant. As I discussed the reason previously, are derived directly from the bacterium known as Streptomyces called Claire. Tetracycline was discovered in the 1940. Duration of action of the tetracycline. Tetracycline are the short-acting, intermediate-acting and the long-acting. Short-acting tetracycline having the half-life of 6 to 8 hours. Opposite of short is long, so the half-life of the tetracycline of long-acting tetracycline is multiple of 8. 8 multiplied by 2, that is 16. Example of the long-acting tetracycline is doxycycline, minocycline. Intermediate-acting tetracycline, the examples are damicocycline, methacycline. The half-life of the intermediate-acting tetracycline is 12 hours, and you can learn the half-life of the intermediate-acting tetracycline is 16 minus 4, that is 12. 8 plus 4, that is 12. Mechanism of action. They bind to the 30S ribosomal subunit and thereby prevent the binding of the amino acyl tRNA to the mRNA ribosome complex. Tetracycline also inhibit the protein synthesis in the host. Spectrum of the activity. Tetracycline are the broad-spectrum antibiotic, active against gram-positive and gram-negative bacteria, mycoplasma and chlamydia. Cell become resistant to tetracycline by the 3 mechanisms: enzymatic, efflux and the ribosomal protection. Enzymatic, rarest type of the resistant, where an acetyl group is added to the molecule causing inactivation of the drug. Efflux resistant gene encode a membrane protein that actively pump tetracycline out of the cell. And in the case of the ribosomal protection, where blocking tetracycline from binding to the ribosome, or specifically 30S ribosome. Tetracycline uses. Here you can see in the red CHLAMYDIA-SYPHILIS-GONORRHEA. These all three are the sexually transmitted diseases. And the drug of the choice for all these is tetracycline. Tetracycline, as you can see in the left side cloud, it is also used to treat acne. and watch for the epigastric discomfort, diarrhea, heartburn, and photosensitivity reaction. It is a broad spectrum antibiotic. Clinical point: oral capsule is the dosage form in which tetracycline are most commonly administered. The capsule should be taken half hour or 2 hours after food. Its best effect can be seen on the empty stomach. Not recommended for the IM route of the administration. Tetracycline may interact with other medicines. Effect of one or both of the drug may change or risk the side effect or may be greater. These drugs are calcium supplements, mineral supplements, multivitamins, cholesterol lowering drugs, and penicillin compound. Indication of the tetracycline. Let's learn with the fun and learn with the mnemonic of the indication of tetracycline. Mnemonic of the indication of tetracycline is vacuum bed room 2. Vacuum. V is for Vibrio cholera, A for acne, C for chlamydia, U for uriplasm urelyticum, M for mycoplasma pneumonia, B for Borrelia burgdorferi, R for rickettsia, and T for tularemia. Adverse effect of the tetracycline is KAPILDEVS. K for kidney damage, A for anti-anabolic effects, P for phototoxicity, I for the diabetes, L for the liver damage, D for dentition, E for epigastric pain, nausea, vomiting, diarrhea, V for vestibular toxicity, S for superinfection. Let's summarize the ADR of the tetracycline, which is GI disturbance, liver failure, vertigo, avoid in pregnancy, phototoxicity, and deposition of the drug in the bone and teeth. That's all from the topic of tetracycline. Thank you so much.